What's up, guys? We're back with episode 9 of Shit I Feel Strongly About. Hi. We haven't been recording for a little while. Today, I don't know that it necessarily falls under the shit I feel strongly about stuff, although portions of it probably does. This is more of an update, I guess, with some teachable moments in there because I'm sure some of you guys have sustained similar things in your life. But I broke my arm. Yeah. About a little over 2 weeks ago now, I fell when I was ice skating and I fractured my radius. It's called a Colles fracture. So, yeah, I'm just kind of like updating you guys, one, on what's happening, and two, I think there's just some teachable moments in like the patient process when somebody sustains an injury. And there's just things that I'm doing that I think most people wouldn't understand to do or know to do or get educated to do in the meantime while I wait for the surgery to get it fixed. So I want to talk about that today. So when I initially fell and broke my wrist, I knew exactly what happened. Probably partially because of my background and as a PT, and partially because I've broken bones before. So I kind of like I knew it. Like I could tell. I know my body. But my first thought was, crap, I broke my wrist. My second thought was, how the hell am I going to pay for this? And that is bullshit. Like straight up. The second thought you have after you sustain an injury, one that's like mildly an emergent situation, your thought should not be, how am I going to pay for this? Like that's just fucked up on so many levels. And what I did was not even like, it could be 1,000 times worse. I broke a bone. There was no nerve damage, no cardiovascular issues. I didn't have a brain injury or anything like that. It was seriously probably like one of the mildest forms of injury that could happen. Still an emergent situation because they had to make sure I wouldn't need surgery immediately. But still, like, I should not be thinking about how I'm going to pay for this the second after I fall and break my wrist. Like, that is fucking bullshit. So this is shit I feel strongly about. I feel very strongly about that. That's really shitty on a lot of levels. And it speaks to a lot of things within our healthcare system that one single person can't necessarily change. But you've probably had an injury before in your life. If not, you've at least had an ache or a pain that you needed to get checked out. So with this injury, I'm gonna fast forward a little bit here. Initially I had the choice of either going a conservative route and staying casted, or going to have the surgery, which they would go in and put like plates and pins and stuff and get everything aligned and whatnot. The conservative route involved them manually shifting the bone back into place, then casting it, and then every 2 weeks across a 6-week period, check in and take x-rays to make sure that it's healing in alignment and everything looks hunky-dory. Initially, so you may be facing or may have faced a decision of whether to go conservative or go a surgical route. And you may approach this in your life too in the future. So some pointers, or I guess some thoughts. Your surgeon is a surgeon, so they're speaking from a biased lens. I am also a PT, so I'm very biased too, based on research, anecdotally, just the system in general. So take what anybody tells you with a grain of salt, clinician, surgeon, whatever, because it's still your body. And you're the one who's going to have to do all the work with the healing and stuff. Yes, you will have support along the way, but you're the one who's going through it all. So take what anybody says with a grain of salt and make your own decision and make it an informed decision. Second piece of advice I'd have, if you're approaching something that's conservative versus surgical approaches for something, is to do your own research. And I don't mean like I was going to say I don't mean read blogs and stuff, but that can be helpful. But what I mean is like look at the long-term outcomes of things. As soon as I found out that there was I had a choice to make, I did a lot of research, like pulled up randomized controlled trials, systematic reviews, everything. I looked at what the long-term outcomes would be for a surgical versus a non-surgical approach for a Colles fracture. And initially I had decided to go with the conservative route because all the research I had found said that the long-term functional outcomes were very similar between doing a manual reduction and casting and a surgical reduction. And reduction means like shifting the bone back in place, essentially. So when I found that out after talking with some informed clinicians and not thinking like a patient and being like, well, which one's faster? I landed on the conservative route. And a lot of the research has said always want to go conservative first, which pretty much lines up with my belief system as well as a PT. But I kind of had to get out of my own head as a patient too. Because initially I was like, which one's faster? I'm going to do whichever one that is, which was marketed to me as a surgery, but realistically, just knowing rehab timelines, it's going to be the same amount of time that I'll be recovering. It just was a difference of how long I'd be casted. So I went with the conservative route first, and made that decision based on the research that I'd done. Same long-term outcomes. If in a year from now I'm going to be in the same place, I might as well try to do it without getting surgery, because that's also a larger financial commitment for myself too, which is also something you should be considering. Know your plan, your insurance plan. So yeah, I went to conservative route first. Then they put me under anesthesia. They moved the bone back in place, casted me up. I went back in 2 weeks. The bone shifted. So then I had to do some more thinking. So it wasn't healing in the right alignment. I had about a 20-degree shift, and the surgeon again recommended doing surgery. He said I could probably be fine with without doing the surgery also. And at that point, I'd gone into that appointment like, all right, they're going to cast me up for another 2 weeks. See you later. Not thinking that I'd run into a snag at all. So, I mean, I left there. They finished, they like completed this cast that I have on now and did some thinking. I sent my x-rays to 2 other surgeons. It's within your right to get second opinions if you need to, or third, fourth, fifth opinions, whatever you need to make the right decision for you. So I sent my x-rays to 2 other surgeons, both of which recommended the surgery given my age and my activity level, and what I want to do. So surgeons are like, it's their job to make everything look the way they should and make everything anatomically correct. But you also have to consider like lifestyle factors. I'm super active. I still want to be able to power clean and do burpees when I'm 54. And I'm a coach and I'm a PT. So I don't want to just sit out the rest of my life for those activities. If I was 65 years old, was okay with not power cleaning anymore, not really coaching classes, I might have a different story or a different thought process with that. So there's a lot of things to consider, your goals and your lifestyle being one of them. And if your surgeon doesn't ask about it, then you need to go ask those questions. Or not even surgeon, if your clinician, anybody, if they don't ask about you personally and what you want to do, then you need to ask those questions, what your life is going to look like, if you go for conservative versus non-surgical route. I now have 3 surgeons telling me that I should probably get the surgery, 2 of whom have nothing to gain by telling me that. Well, 3. None of them really have anything to gain with it, but that's 3 people telling me that I should probably get the surgery given my age and my activity level. So then I did more research and looked at outcomes of a distal radial fracture, a distal radius fracture with a dorsal angulation, and looked at what those outcomes would be, whether I got the surgery or not. And if you don't know how to read research or how to look those things up, get somebody who will know how to do that and interpret some of that for you, because I think that's important. Just to know what the research and the majority says. I was given a worst case scenario thing, and in the grand scheme of things, the worst case scenario rarely ever happens. So, but you still want to look at what the actual research says and interpret that however you may, given your life circumstances. So I ultimately decided on doing the surgery. I feel much more confident about that decision now because I've done my research. I've had 3 separate surgeons who tell me that I probably should do it and I'll be better off in the long run for it. My only snag was the financial side of things. But a friend had brought up a interesting question to me, which may be helpful for you. And he said, which scenario would you regret more? Would you regret getting the surgery and paying this large sum of money? Or would you regret not getting the surgery and potentially having some residual deficits because of a malalignment with the bone, which could lead to like arthritis or other injuries or pain or an instability? And I said, I would regret that one more. And he was like, there's your interest. Stop looking things up. So that was a pretty good point. There's obviously payment plans and stuff like that. So all that being said, think about your lifestyle, do your own research, make your decision for yourself and your circumstances. So kind of stepping back from that, instead of being a sitting duck, there are a couple things that I've been doing just because of what I know about the human body and in my PT and coach and strength and conditioning background that are going to set me up for success when I am able to actually start moving this thing specifically. I've been trying to get more steps per day because your non-exercise activity actually makes up for a larger percentage of how much energy your body expends throughout the day than your like 1 hour workout session in the gym. So because I'm not able to push myself as much in the gym as I normally am, I'm trying to just move more throughout the day and accumulate more steps throughout the day, which is probably something I should do, injured or not. But it's something I've definitely put a more emphasis on since getting injured, since I can't feel that same intensity or that same effort level as I normally would when I'm in the gym. So again, your non-exercise activity level makes up for probably about 15% of your total daily energy that you expend, and that hour in the gym makes up about 5%. So I've just been moving more throughout the day. I've made it a goal for myself to hit a certain number of steps that was a little bit higher than what my average number was before I fractured my wrist. So that's a big one. Move more throughout the day. It is like the lowest hanging fruit. Walk your dog more. Park farther away at the grocery store. All that. Just move a little bit more. Second being sleeping. You need to get good sleep. Damn it. This is one I kind of struggle with a little bit. I've been honestly a goal for 2021 for me anyway was to have better sleep hygiene. So this timed out pretty good, I guess, right? But yeah, sleeping, aiming for like 7 to 9 hours a night is the general recommendation for adults. Depending on your age, there's different ranges. Like I think teenagers are supposed to get 12 hours or something like that. But we know from research that lack of sleep can put you at higher risk of other injury and it decreases your athletic performance. So there's a whole host of reasons that you should be getting sleep, not even from like a physical standpoint, but like metabolically, stress level, all that. So prioritizing sleep is going to be huge for yourself. So prioritizing sleep and then moving more throughout the day, your non-exercise activity. And then lastly, strength training, continuing to strength train. So there's some research out there that says that there's like this crossover strength, I think it's called a crossover strength training effect. There's some research that shows that if I'm training the non-injured limb, that there's going to be somewhere between like a 7-8% increase in strength in the injured limb, even if I'm not doing it. So I'm going to keep working this arm, even though I'm going to look like Popeye on this side and a wet noodle on this side. But there's a lot of merit to that. And even without the crossover strength training effect, if that's not a thing, or if you don't believe that, me strength training and improving my muscle capacity and strength is going to affect my BMR. it's going to maintain some level of a strength level, so that when I get back to actually being able to move this thing, or even just like the little rehab stuff that I'm going to have to start off with, I'm going to be a little bit more ahead, and my body's going to be able to sustain more of that, more challenge in that respect when I first start, because I haven't stopped training. So those three things are the big ones. Nutrition, I would say, is probably a fourth one. You want to make sure you're getting enough calories, potentially more calories, to help offset the stress state that your body is in, while trying to heal with an injury. That's going to be specific for everybody else, but for me, I'm trying to get more protein, which has been really hard because I haven't been that hungry. Trying to get more protein and making sure I'm still eating all my leafy greens that have calcium and vitamin D and all that. Pulling it all together, if you are in a situation where you're trying to decide whether to go surgical versus a non surgical route, do your research, talk to people. You can take your time to make this decision. It is your body, it is still you who has to go through the healing process. And big things that you can do, whether you're deciding on surgery or not, like you may just be dealing with an ache or pain, moving more throughout the day, getting more non exercise activity, sleeping like you care, or sleeping like you wish you could for the rest of your life. Still continuing strength training, and then some level of nutrition. So those are my big recommendations for today. If you like this content, hit subscribe, and I'll see you soon.